Hi, I'm Dr. Matt Alexander, and today I have my lovely patient here, Julie, and we are going to do an adjustment on her today, and we're also going to give her first treatment with the Y-strap. So, Julie, why don't you go ahead and tell us, what's bothering you today?
Today I'm having some tightness in my upper back and neck, some stiffness, and my right hip has been actually bothering me, a little bit painful.
Okay.
And I feel like my knee has been...
Right knee?
Yeah, my right knee has been maybe out a little bit. It's not as much rotation in it.
Okay, good. Well, I'm going to have you stand up and go ahead and check your posture, okay?
Okay.
Julie, can I please have you go ahead and turn your head to both sides all the way? Good. Do you notice any tightness or stiffness doing that?
Right
On the right side?
Yeah.
Okay. What about laterally flexing to the sides? Doing okay there?
Same.
Same on the right side? Okay. What about back and all the way forward? Good. How do you feel with that?
Stiff.
Stiff? Okay.
Mhm.
What about twisting side to side here?
Okay.
Okay. What about laterally flexing all the way side to side? Okay, any stiffness there?
No.
Okay. Can you go back like that?
With my fist like this?
Yeah, just straight back there. Perfect. And then go ahead and put your hands together like this and bend down straight forward all the way down. Good. Any pain or discomfort doing that?
No.
Okay, come on up. So what we'll do now is we're going to go ahead and have you lie face down. I'm going to feel your joints and see how they're moving. There should be a nice glide to them. If they're stuck, then that's not good. Okay, your feet look pretty even. That's great. We always check those because it's an indicator of how your pelvis is lined up. So we're going to check first your sacroiliac joints on both sides at the top and down at the bottom, and see how those are gliding. They feel okay. Now you said you get a little more stiffness on the right side?
Yeah. Right.
Okay. And that's the same side you have the bad knee on too, right?
Yes.
Okay. Good. Okay, I'm checking L5, 4, 3, 2, 1. Good, then we're going to check her thoracics all the way up. And I definitely feel that stiffness right in here that you were talking about. All the way up here to about T1 there. Then we're going to come out to the ribs and see how all her ribs are moving all the way up. Again, a little tightness right in through there, more on the left side there. Good, and we're going to see how the muscles and joints are moving here in her neck. Great. You okay there, Julie?
I am.
Okay. So what we're going to do here is called a side posture adjustment. And this adjustment, you can adjust the sacrum, you can adjust the sacroiliac joints, and you can adjust all 5 of the lumbar vertebra. So 1, 2, 3, 4, 5. So today she had some tightness in the sacroiliac joints, so we're going to go ahead and adjust that on both sides. So what we're going to do is bring her knee over this way and contact right at that sacroiliac joint, and bring her over and just give her a little push here. There we go, good. So it was pretty stuck, so I had to give her a second push. Then we're going to go ahead and get you on the other side as well, okay? Okay, so now we're going to go ahead and get the right side. And again, we're going to bring that knee over and just give her a little push right here. Good. Okay, and go ahead and lie down face up for me, okay? So the next adjustment we're going to do on Julie is for her mid-back. So this is going to be from her T1, her first thoracic vertebra, all the way down to her T12. And this adjustment, we're going to be focusing on the upper part of her thoracic because that's where she's really tight at. So this move we're using is called an anterior dorsal move. And it's a really great move to loosen up the lower back, or the mid-back, I should say, without causing a lot of pressure. So there's other ways to do this move as well, where the patient is face down and you're pushing in different ways. I've noticed that a lot of patients prefer this method, not all patients, but a lot of prefer this method because we can use their own body weight, and you don't have to push quite as hard. So I'm going to go ahead and bring you over this way. Good. And I'll have you take a deep breath in and go ahead and breathe out. One more in and out. Good. Okay, now we're going to go ahead and adjust her neck. The vertebrae in the neck are called the cervical vertebra, and there are 7 cervical vertebrae, and we're going to go ahead and first check to see how they're moving by pushing one by one, side to side. and we're checking to see how they glide. So when I get here at her C4, C5 area, it's definitely stuck. And we're going to move all the way up to check her top vertebra, which is called the atlas, one of the most important vertebrae to check in the spine because it has a big influence on the nervous system. And hers is a little bit stuck and shifted over to the left too. So what we're going to go ahead and do is do a C5 adjustment on the right, and then we're going to do an atlas adjustment on the left. So first thing we're going to do is go ahead and laterally flex her head to the right, give a little bit of rotation, have her look up and over to the left, and just give her a little push that way. And we're going to go over this way and give her a little push over to the right. Good. There we go. Perfect. And then we check afterwards to see how she's moving. Moving a little bit better. Good. Okay. Okay, so we are going to use the Y strap today. It's been getting a lot of buzz on YouTube lately. This particular strap goes around the head and we pull straight up. It's called axial traction. And you can actually do the same move with the Y strap with your hands just pulling as the doctor. You don't need the strap. However, on larger patients, not on petite patients like Julie, but on larger patients, it can be helpful because you can really get a stronger pull with it than you can with just the hands. One of the things we do is right now Julie has her legs bent, which is how we're going to have her in this for this particular procedure. If the patient has a lot of tightness down in their lower back, we would actually want to have her legs out straight, and that would give a little more friction to the table and allow us to get actually a better pull into the lower back as well. For her, we're going to be focusing on the mid-back and neck area, so we're going to have her legs bent and keep her hands on her tummy there. So the Y strap is really a pretty simple device. You can see here. And it's got a Velcro piece here. I'm going to pull that off. And we're going to go ahead and have her lift her head and sweep her hair to the side. We're going to go ahead and set that under. Go ahead and lay down there. Back down. Good. I'm going to pull this out. And bring it around here. Okay. And then we're going to go ahead and add in this Velcro strap right under the chin. Right there. Now some docs I've seen don't like to use the Velcro strap. And it's not really necessary, but if you gives you a little bit more grip. And then what I usually like to do is do a test first to make sure it's going to be a comfortable procedure for the patient. Because it can be kind of intense, but it really does relieve a lot of pressure in the right patient. So typically I like to give a little pull upward first and ask the patient, does that feel good or does that feel bad when I pull up? It feels good?
Yeah.
Okay. So if you're getting any type of pain or pinching as you're pulling up, this is probably not the right procedure for you. But if it feels relieving, like it's relieving pressure, and of course the doctor's done a full history and exam on the patient, and a lot of times including x-rays to rule out any problems, this can be a really great procedure for many folks. So what we're going to do is go ahead and hold this spot here to keep a good tension on her head so we don't slip. And then we're going to grab right under here and give a little pull here. And then right at the end, just like that. And sometimes the strap will come off a little bit as well. Did you feel good?
Yeah.
Okay.
Yeah.
Did you feel anything release in there?
Yeah, right below my neck.
Okay.
Yeah.
Perfect.
Yeah.
All right, so we're done with your adjustment for today, Julie. I know you said you were having some tightness in here, was it?
Yes.
Yeah.
Yeah.
And what did that feel like before you got adjusted?
So I came in with some tightness in my mid-back
Yeah.
and neck,
Okay.
and after you adjusted me both with your manual adjustment and the Y strap, it just relieved that tension that I had, and I feel a lot lighter actually.
Okay.
Yeah.
Cool. Now, did it hurt when you got adjusted?
It didn't hurt. There was pressure, but it wasn't painful.
Okay. And then what did the Y strap feel like when that was getting pulled?
It was kind of tight around your face right here,
Uh-huh.
but the actual movement, it was relieving
Okay,
the pressure
cool.
and the pain. So,
Okay. Nice. I know a lot of patients probably wonder what that's going to feel like.
Yeah.
But it feels like it's relieving pressure, it sounds like.
It does. It does relieve the pressure. You kind of feel a little bit strange when you have it on, but after it's done, worlds of difference.
Nice. Thank you.
You're welcome.
Well, thank you for watching our video today, and if you liked what you saw, go ahead and like the video and subscribe and ring the bell, and then you can look for our contact information for down below. We're located in Livermore. The practice is Alexander Chiropractic.